So what exactly is CrowdHealth?
Yeah, and so in essence, what we did was, after I had to pay that $8,000. I called my insurance plan. I was like, I'm done.
Mm.
I'm not going to pay your bills anymore because you're not going to pay my bills. And so we went uninsured. And at first, that was scary. Like, two kids, a family, like going uninsured, is scary. But we ultimately built a bunch of tools that allowed us to viably operate outside of the insurance kind of system. I call it the medical industrial complex. And in essence, what that is like I could have negotiated that bill. I didn't know that.
Mm.
So that $8,000, I probably could have negotiated it down to like $1,500, $2,000 somewhere in there. And so, we built a negotiation platform that allows, us to negotiate on our members' behalfs with the hospital. So you get the bills way down.
Wow.
We knew virtual care. If you go online, you can get a doctor, for sub $100 to have a primary care visit with you.
Yep.
So, um, I have access to Direct or GoodRx, which is an online prescription company that gets you prescriptions if you're not insured for significantly less. We're getting like 80% better pricing on prescription drugs than what your health insurance plan is paying. So we started building all these tools. The big one outlier was like, okay, what happens if cancer happens, or I get in a motorcycle accident, or one of those big, an emergency room visit, something like that.
Right.
And it's like, okay, well, if we start getting a bunch of people together who will all raise their hand and say, hey, I'll help if Andy or Dom or Harry or whoever, has a big health event. And if we can get enough of those people together that will raise their hand to help out, then I think we can take care of these big health events and help people pay for those. So in essence, what happens is, if I break my arm and it's $5,000, I'll pay the first $500 of it. I'll submit the remaining portion, $4,500, to the community. So we'll ask 45 people in the community for $100, and they will, if they say yes, then they'll send $100 to my little health wallet, considered a Venmo account. I got a little, Venmo account. Money comes into it. I now have $4,500 plus my $500 to pay for my broken arm.
Right.
And so that's in essence how that works. And then, when I show up to the doctor's office, I can pay him in cash. And so the doctor's office is willing to give me significantly better pricing because I'm paying him at the point of care in cash, and that doctor doesn't have to bill health insurance, which saves them 30 or 40% by just doing that, right? So, and we've done now, we're on bill something like 10,000 over the last 3 years, and it's been everything from like a $49 pediatric visit to hundreds of thousands of dollars worth of brain hemorrhages. We had a brain surgery last week. We've had a number of NICU babies. We've had half a dozen or more cancer cases. And so we've been able to use this system to pay for, or help people pay for, small bills in addition to big bills. And the benefits of that are, the price is, half of what you'd pay for health insurance. There's no networks. There's no big deductibles. It's just a way better way of paying for healthcare. It's freedom in healthcare from our perspective.